30 million people in Europe are affected by asthma, according to the European Federation of Allergy and Airway Diseases Patients Association. Laura Davies is one of those living with the chronic disease.
I've had trouble, forever really, with dust and with breathing sometimes. So it started just getting worse when I played a lot of handball when I was a kid. So it would be, especially like after the game, I would have a hard time breathing. So my mom just sort of suggested, well, let's go and see if they can do something about it. And then I got diagnosed with asthma and got my inhaler. When I get it, I get sort of an itching, a really weird, like it itches but like on the inside of your throat, and it goes down to my chest. So one thing is your throat obviously closes up because of the swelling. But it sort of itches as well, so it's really weird sort of, it feels almost like you're having an allergy attack, but it's combined with the fact that you can't breathe. One time I ran out of my inhaler, so I didn't have it. And it was weekend, so I couldn't get one. And it was, winter outside, and it was cold, and the candles affect you, like the smoke makes it even worse. And it was Christmas, so when you had to go to bed at night, I didn't sleep at all that night because lying down made it worse. So your throat just closed up to such a point that it's like it's wheezing, like I'm freaking my family out because I'm like in the corner. It sounds like you're dying basically. So sitting up is probably easier because you get the airflow is easier. But that's sort of one of the times, so then it gets quite scary when you can't stop it, and you're just gonna have to wait it out.
Jakob Boonlegi, assistant professor in the Department of Public Health at Aarhus University, says that air pollution impacts public health in different ways.
We usually distinguish between short-term effects that arise if you are exposed on a day with a lot of air pollution, where there will be increased risks of, if you have a cardiac disease already, there will be increased risk of maybe having a cardiac attack on that particular day. Or if you have the disease asthma already, there's an increased risk of having an asthma attack. And then the chronic effects, the long-term effects, and air pollution and the levels that exist in Denmark can actually have long-term effects, increase the risk of lung cancer, of chronic bronchitis, of cardiovascular disease, and other diseases as well.
The European Environmental Agency finds that air pollution causes 400,000 premature deaths every year in the EU. The Clean Air Package, a proposal put forth by the EU Commission that aims to regulate pollution, was withdrawn last December. The Commission estimates the proposal would save up to 58,000 lives a year. Members of the European Parliament have mixed reaction to the Commission's decision to withdraw the proposal.
I consider it a disaster. We have had no example that environment was in the focus on ambition, and always when old-fashioned business, and they are, the loudspeakers for old-fashioned business, when they are calling for better regulation, it always means less regulation.
I think I'm a bit split, because if they come up with a better proposal, a more ambitious one, then it's good. But if the withdrawal ends up with a less ambitious proposal, I think it is a problem. So let's wait and see what will happen. But we will, here from the Parliament at least, be quite strong in order to demand something done with the air pollution.
I will fear that what they call improvements are worsening. And improvement means it's easier for old-fashioned business to live up to it, because then they don't need to do anything.
It is important that we consider the health of the citizens, but the way to reduce the pollution, here you have to do something. For instance, regulate the cars about their emission. You have to have certain standards all around Europe, and in order, due to the internal market, you have to regulate it at European level. So I think it is good to do. It is needed to do, but of course we also have to focus on how to do it in the best way.